Hi everyone, welcome back to today's video, and in this video we will be discussing about Cohen's Kappa, which is a very important topic in biostatistics. So before going to the definition, formula and the examples, we will first discuss the scenario to make the concept clear. So let's say there are two doctors who read x-rays on two different days to diagnose pneumonia. So let's say this is Monday and let's say this is Tuesday. Doctor A diagnosed that on Monday there are 3 positive cases out of 5 total cases. Dr. B also says there are 3 positive cases out of 5 cases on Monday. So they both say that there are 3 out of 5 positive cases. But on Tuesday, Dr. A remains the same. He is the same, like he diagnosed 3 out of 5 cases as positive. But Dr. B only diagnosed 1 positive case on Tuesday. But what is happening here? If you see closely, the level of agreement between these two doctors is same on both Monday and Tuesday. So they are diagnosing this case as positive and positive, this case positive and positive, this case as negative and negative. So 3 out of 5 times they agree. On Tuesday, they agree again 3 out of 5 times. But Dr. B is only diagnosing 1 case as positive. So there is something going on here. So we will see what is that something. This is a chance. This is due to this chance that their level of agreement is same on both Monday and Tuesday. So we will dissect this out, that what is this level of agreement by chance, and we will minus that to get the actual agreement between these two doctors. This is Cohen's Kappa. So let's move forward. How do we determine the level of agreement pertaining to radiological diagnosis in the most natural way? If we have not discussed what we have discussed just now, how will you determine the level of agreement? You will say they are agreeing here, they are agreeing here, they are agreeing here, so 3 out of 5 times. You will say they are agreeing here, here and here, so 3 out of 5 times. This is the most natural way. So this is called observed agreement. This is 3 by 5 in both cases. Please remember this value. This is the observed agreement. We will use this in when we discuss further, and we will use the formula. So the observed agreement is 3 by 5 on both Monday and Tuesday. Let's move further. So the most natural way to determine the level of agreement between these doctors is to count the number of times they agreed with each other, as we have done, divided by total number of observations. So this is 3, the number of times they agreed with each other in the example, and total number of observations were 5. So 3 out of 5 is the observed agreement, right? So this is, I have shown the level of agreement in the observed agreement. So the probability of diagnosis for each doctor. So if you see, Dr. A is diagnosis positive 3 out of 5 times on both Monday and Tuesday. But Dr. B is diagnosing positive 3 out of 5 times on Monday, but only 1 out of 5 times on Tuesday. But again, the level of agreement is same on both Monday and Tuesdays. But she is little bit more cautious on Tuesday, but still the level of agreement is same. So what you will say? If she is very cautious today, like on Tuesday, but still the level of agreement is same, is it due to chance or is it the actual agreement? On Tuesday I am talking about. On Tuesday she is very cautious, but still the level of agreement is same. That means it is not due to chance. There is less element of chance. This is the actual agreement that is happening between two doctors. But when she is not very cautious, then the level of agreement, same 3 out of 5, can be due to chance. So how can we measure this element of chance in the level of agreement between two doctors mathematically? That is what we will see in the next slides. So we will not get the true picture of true agreement between these two doctors without removing the element of chance. So we have to remove this element of chance to know whether they are actually agreeing or the agreement is happening just by chance. So how do we calculate the probability of this random chance? So we will say that Dr. A has diagnosed positive and Dr. B has diagnosed positive. That is agreement. Dr. B has diagnosed negative, Dr. A has diagnosed negative, Dr. B has diagnosed negative. That is also agreement. So these are the only two cases of agreement, because we are doing either positive or either negative. So in probability, when we use and this happening, we will multiply those values, right? So positive diagnosis happening, we will multiply these values. Negative diagnosis happening, we will multiply these value, and we will add these. So if you see the previous slide, Dr. A diagnosed positive 3 out of 5 times on Monday. Dr. B diagnosed 3 out of 5 times on Monday. Dr. A diagnosed negative on Monday 2 out of 5 times, and similarly Dr. B diagnosed negative 2 out of 5 times on Monday. If you see here, Dr. B diagnosed positive on Monday 3 out of 5 times. Dr. B diagnosed positive 3 out of 5 times. Negative 2 out of 5 times. Negative 2 out of 5 times. So we have just filled in the values here, and we get the probability of chance as 13 out of 25 times. Similarly, if you calculate or for Tuesday, it will be 11 by 25 because of this 4 by 5. Dr. B is diagnosing negative 4 out of 5 times. So you will get 11 by 25. Now if you see, we are calculating the probability of random chance. It is more on Monday because Dr. B is not very cautious on Monday. She is diagnosing more positives. And Dr. A is also diagnosing like 3 out of 5 times, and she is also diagnosing 3 out of 5 times. So there is more element of chance here. But if she becomes very cautious, there is less element of chance. So that is what we are seeing here. On Monday, there are more element of chance. On Tuesday, there are less element of chance. Is it clear? I hope this is clear. So the diagrammatic representation of it. So suppose this is a complete agreement where both the doctors diagnose 5 out of 5 x-rays as positive. This is no agreement. Dr. A and B doesn't agree on any x-ray, 0 out of 5. So this is the observed agreement, 3 out of 5. So let's say this is the observed agreement. So it is same on both the days as we have seen before. But the chance agreement was 13 out of 25 as we have calculated by probability formula on Monday, and 11 out of 25 by probability formula on Tuesday. So where do you think, Monday or Tuesday, the actual agreement is more? You can see this. So actual agreement is more on Monday because there is less chance. This is what we have discussed logically also, mathematically also. So now how will we calculate the actual agreement? So this value, the actual agreement, divided by this value is Cohen's kappa, which tells us the actual agreement. So let's see, how do we calculate? So can you see my both the slides? Okay. So if we minus from whole this value, then what we will be remaining with? This value, this particular thing. So 3 out of 5, this whole 3 by 5 minus this part is this bold arrow, right? Minus divided by this whole thing. What is this whole thing? 1 minus 13 by 25. So this total is 1. If this total is 1, if I subtract, this total is 1, and if I subtract this part from this whole one, then what I will be remaining with? This complete part. So this is this part. 1 minus 13 by 25, this part. And on the numerator, what I am doing? I am subtracting from this part, this part. So what I will remain with? This bold arrow. So this is Cohen's kappa. Again, diagrammatically, this divided by this is Cohen's kappa. if you look at the formula of Cohen's kappa, it is the observed agreement minus the expected agreement by chance. So what is the observed agreement? This 3 by 5. As we have seen, the observed agreement is 3 by 5 minus like subtracting the expected difference by chance. So we will subtract 13 by 25. So observed agreement minus expected agreement by chance divided by 1 minus expected agreement by chance. So this total is 1 minus expected agreement by chance. I hope this is clear. So in summary, this value divided by whole of this value is Cohen's kappa. And what it tells us? Actual agreement. Minusing the agreement by chance. Subtracting the agreement by chance. So this is Cohen's kappa. I hope this is clear. So this is the basic concept of Cohen's kappa. It measures the actual agreement between two observers in a clinical study or in a clinical scenario or any medical study. So for Monday, if you calculate, I have shown the calculation. The Cohen's kappa is 1 by 6, and on Tuesday, just try to calculate it. It will be 2 by 7. So giving you an example, suppose two radiologists classify 100 X-rays. Both say that there is a fracture on 30 and both say there is no fracture on 50. So the observed agreement, because they are agreeing on positives and they are agreeing on negatives. 30 by 50 divided by 100, the total number of X-rays. Chance agreement, rater A says 40 fractures and 60 no fractures. Rater B says 50 fractures and 50 no fractures. So this is positive for rater A, positive for rater B. We multiply these values because they are agreeing on positives here. They are agreeing on negatives here. So we will multiply 60, this 60 no fracture multiplied by 50 no fracture, and we will add these values. So we will get the expected agreement by chance. Now we can put the formula, this formula, and you will get the answer. I hope this is clear. So what is Cohen's kappa? Now coming to the definition, a statistics that measures agreement between two raters beyond what would occur by chance, the true agreement. Used when there are two raters or categorical outcomes are there, yes or no, normal, abnormal. You cannot do it on a continuous variables, right? It adjusts for chance agreement better than raw percentage agreement. Pretty obvious, like what we have discussed. So this table is very important. They ask you direct question that what is the interpretation. So you have to remember this, that if there is less than 0 Cohen's kappa value, then the interpretation is worse than chance. 0 to 0.0, there is slight element of actual, there is slight element of actual agreement, sorry. 0.21 to 0.0, fair. 0.41 to 60, moderate. 61 to 80, substantial. And greater than 80%, almost perfect. So you can remember 20, 40, 60, 80. Right? That is how we remember. Slight, fair, moderate, substantial, almost perfect. But if you can remember all of this, then please remember that greater than 80 is excellent chance, less than 40% is weak chance. They ask this like very often. So what MCCQE and USMLE question will want you to say, if less than 0, poor agreement. Because less kappa value, less agreement, actual agreement, so poor agreement. Less than 20%, barely better than chance. They ask this in like they give this what do you call this wording. So greater than 60 to 80%, most medical studies fail here. 80% to 100%, very strong agreement. But please remember these values. These are important. I hope this is clear. So what is the Kappa paradox? So if the prevalence is very low or very high, that is skewed prevalence, then the chance agreement is very high. Cohen's kappa will be very less because chance will be very high. So question can use the term skewed prevalence for kappa paradox. So remember, if the prevalence is very low or very high, chance agreement is very high. So two raters have 90% agreements, but Cohen's kappa is 0.1%. They have 90% agreement, but kappa is only 0.1%. Sorry, 0.1. That is 10%. So why this will happen? Why will they have so much of agreement? Because the prevalence is very low or very high. When the prevalence is very low or very high, chance agreement tends to be very high. This is called Cohen's kappa's paradox. So this is from my side. This is basically Cohen's kappa. I hope you like this video, and if so, please like, share and subscribe, and thanks a lot.